Okay, so today we're going to talk about the 9 causes of lethargy. Now, what is lethargy compared to fatigue? Well, it's fatigue with a twist. It's fatigue with decreased activity. You're kind of apathetic, kind of depressed a little bit. You're lacking motivation. You're lacking creativity. So that's what lethargy is. Now, there are 9 different causes. So let's just kind of run through the list. Number 1, sustained stress, where you're pushing your adrenals and pushing, and of course, not recovering along the way. Let's say that you have 3 small children, right? And you're working 2 jobs and you can't sleep and you're pushing yourself. That's called sustained stress. Number 2, overtraining. So you start working out and you're doing CrossFit, which is quite intense, and you're doing that every day. You're going to feel lethargy because you're not going to give your body a chance to recover. Next one, lack of sleep. Well, that could come from sustained stress. Many weeks of not sleeping, you are going to be lethargic. Number 4, let's say you're studying, right? And you're studying a technical subject and there's a lot of big words. Well, if you keep pushing through these words without looking them up, you are going to be very tired and lethargic. This is why we have dictionaries. All right, number 5, excessive stimulants. So you're tired and you're drinking Red Bull, drinking coffee all day, you will start feeling lethargic. All right, number 6, hidden infections. Now, this can be either like Epstein-Barr virus, which you had maybe a long time ago, that's being reactivated because you're under sustained stress. Stress will reactivate viruses that have been in remission or dormant. Also, you could have like a little cavitation underneath a tooth infection, and that can create a lot of inflammation, fatigue, even arthritis. So any type of hidden infection, even Lyme disease, that could actually be a situation where you're lethargic all the time. All right, number 7, EMFs, electromagnetic fields. I've done different videos on this topic. I'm going to do more, but this thing right here, if you're like on your cell phone all day or you're in front of your computer all day with your headphones, you are going to feel lethargic. Now, I'm going to give you a lot of solutions for that. All right, number 8, old injuries. Now, I'll come back to that in a bit. Number 9, nutritional deficiencies will definitely cause you to be lethargic. So these are all the potential causes, but how do you really find out which one is behind your lethargy? Well, you need to isolate, number 1, where this lethargy is located. Is it in your head? Is it in your sinuses? Is it in the back of your neck? Is it in your front of your neck? Is it in your chest? Like, where is this lethargy located? That will give you clues. So, for example, let's say you had mono when you're in high school, which is Epstein-Barr virus. And now it's like years later and you feel a lot of heaviness and lethargy around your neck, okay? Well, some of that virus can get reactivated. And so there are various things that you can do for that situation. I put a link down below. Let's say your lethargy is in your head, okay? And you had some head trauma. Well, old injuries, especially in the head, can make you lethargic years later. Now, I put a link down below of how to address head injuries. One day, I had a patient, when I was in practice, have this serious lethargy and insomnia for years. And come to find out, it all occurred after this car accident where this huge box, fell off of a truck in front of her and fell on her head. And so I did some work on her as far as I addressed this injury, and I'm going to show you the technique in a link down below. And when I was done doing this technique, her whole face changed. I said, go look in the mirror. She looked in the mirror. She looked younger. She actually looked like this sense of relief because old injuries tend to accumulate. And apparently that injury still stuck in her skull and creating problems years later. Interesting connection, but you wouldn't normally connect the dots unless someone brought it up as a potential problem. So let's say, for example, this lethargy is like in your chest, and maybe it all started after you had pneumonia or some lung infection. Again, these are just clues to try to pull out what the potential problem is. When did your lethargy start exactly? And what did you do just before that? That will also give you clues on what could be causing your lethargy. For example, let's say you changed your diet and you went on a high carb diet and you created all these nutritional deficiencies. Well, then we know that's the root cause. I mean, you just want to find out when it started and what might have triggered it. That's going to give you a lot of information, and you'd be surprised how many doctors don't ever ask that one question. You can get a huge clue on what could be causing the problem, because there's always something that occurs right before you get a specific symptom. And then what I would recommend is test out one theory at a time and see what it is. So for example, if you think it's overtraining, stop exercising for a week and see if your lethargy goes away. Let's say there's a hidden infection. Well, you can take oregano oil, garlic, which can actually help your immune system, and see if you feel better. Now, this also brings up another point. I've had patients come in and tell me they go to the doctor, they're given an antibiotic, and they have all these positive benefits like energy, and their arthritis goes away when they're trying to handle some bacterial infection, but all these other benefits come up because they had this other infection going on at the same time that was zapping their energy. So in that case, what's the solution? Do you just keep taking antibiotics? No, you build up your immune system. You take natural antibiotics like oregano and garlic and clove and even thyme. All these things can actually clear out infections, not to mention going in on a long fast can do it as well. So you just want to go down the list and start to rule things out. EMF, electromagnetic fields. Let's say you stay away from your computer for a couple of days and oh my gosh, you feel so much better because you change your environment. So anyway, these are some tips, some things that you can do, and also some additional possible causes that you may have not have thought about. And additionally, some potential causes that maybe you weren't aware of. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call, but I put the number down below so you can call and get some help.